Hello, and welcome to our program, What School Personnel Need to Know About a Student's Cancer Diagnosis, Practical Information and Strategies for Support. I'm Karen DeMairo, the Vice President of Education Support and Integration for the Leukemia and Lymphoma Society, and I am joined today by Dr. Mary Kay Irwin of Nationwide Children's Hospital. So as been the catchphrase for the last 10 months, we're going to pivot a bit today. As part of the session today, you will see videos and hear portions of interviews from the Staying Connected online program. In order to do this, due to some technical difficulties, we'll be presenting the program in edit mode as opposed to presentation mode. I hope this does not distract from the quality of the content. So here you see the learning objectives for today. We will be discussing how to address the needs of children, adolescents, and young adults who have survived or are being treated for any type of cancer. We'll share an overview of the medical, psychosocial, and educational aspects of a cancer diagnosis and how these can affect the student, their family, peers, and the school community. As I mentioned, you will meet several cancer survivors, their families, and education and healthcare professionals as they discuss their experience with cancer. So the mission of the Leukemia and Lymphoma Society is to cure the blood cancers and improve the quality of life of patients and their families. And it is to this end that Staying Connected is part of improving that quality of life. So Staying Connected, facilitating the learning experience during and after cancer treatment, is part of the Trish Green Back to School program for children diagnosed with cancer, which is a bigger effort to provide education, resources, and support for children diagnosed with a blood cancer. This online program was originally developed with support from Livestrong as an in-person educational opportunity for school personnel to learn about pediatric cancer, the late effects of treatment, and the educational implications for students associated with these diseases. It was originally titled, Welcome Back. Over the years, it's become quite evident that not only should we broaden the target audience to include parents, older students, or adolescents and young adults, siblings, and a more general group of school personnel beyond teachers and the school nurse, but to also expand the dissemination approach by developing an online version of this program. The program now also includes a more multidisciplinary approach, including added information related to psychosocial issues and grief. The focus of the information has been enhanced to include all cancers. Additionally, videos of actual interviews with patients, parents, and healthcare providers have been added. The program focuses on a more multidisciplinary approach to supporting the educational needs of children diagnosed with cancer. And more details on the program and how to access it will be given at the end of this presentation. So here's a quick breakdown of childhood cancer diagnoses. This information is included in the actual program. It's a helpful chart when presenting to schools or parents. You'll find this information is some of what we will update on a regular basis. And while people may not think the overall number is large, just over 16,000 per year, it's good to point out that chances are at some point school personnel will encounter a childhood cancer survivor, and that the blood cancers and cancers of the brain and central nervous system account for about 50% of all childhood cancers. Sorry, I went too fast there. So there's not much known about what causes cancers in children. Most are caused by random genetic mutations and may be impacted by environmental and genetic factors that can contribute to the cancer growing. As you can see, many of these children will suffer some type of severe or life-threatening complication later on in their lives. approximately about 60%. These are what we call late effects. A late effect is a side effect of cancer and its treatment that occurs or persists after cancer treatment has ended. And even though we've made great strides, 1 in 8 children will not survive their cancer, and cancer remains the #1 cause of death by disease in children. Compared with cancer in adults, the incidence in children, adolescents, and young adults cancer is rare. Today, there are approximately 429,000 adult survivors of childhood cancer in the United States. Over the last 3 decades, survival rates for childhood cancers have increased dramatically, resulting in a large population of these childhood cancer survivors. This increase in child cancer survivorship in children is due to advances in research that have led to more successful therapies and outcomes. Cure rates for acute lymphocytic leukemia, or ALL, the most common childhood cancer, have gone from less than 5% to over 85% in a 50-year period. Treatments are intensive and have significant impact on the young patients. Childhood cancer survivors often experience physical and cognitive late effects that are secondary to their cancer or its treatment. These late effects can cause significant learning problems for the child throughout his or her academic life, including deficits in their ability to communicate, visual memory, processing of information, attention span, mathematical computing, reading comprehension, handwriting, and organizational skills. So it's important to educate school personnel what the child and their family has or is experiencing and how to advocate for them during and after treatment. But in the largest scheme of things, cancer in children is not common. So depending on the type of cancer, various treatments are utilized. Treatment plans can include one or more of the following types of interventions: close monitoring of a tumor without invasive intervention, chemotherapy, surgery, radiation therapy, or transplant. Newer treatments continue to emerge, especially as experts are learning how to individualize treatment based on the genetics associated with the patient and of the tumor. So some changes and thoughts that we wanted to note. So the current COG-ALL protocol includes all boys and girls being treated the same length of time. In other words, shortening the treatment time for boys. For patients who are already on therapy and not on the current open studies, providers may offer changing the length to match the current protocol if parents are willing to do that. There are also some changes to the number of vincristine doses in some cases. All the same drugs are being used, so it's not expected that there would be any new late effects, but hopefully by decreasing the doses, we will see less. The push continues to be withholding radiation as much as possible. And the current ALL protocols also bring in immunotherapy earlier, depending on response and risks, such as CAR T therapy. Physicians are also becoming better at risk stratification in leukemia, lymphoma, and brain tumors to identify the children that can receive a reduced amount of therapy compared to the higher risk patients. Risk stratification is determined by tumor type or pathology, genetic markers and mutations, and response to therapy. There's a collaborative global master clinical trial, or better known as PEDAL, organized by the Leukemia Lymphoma Society, the Children's Oncology Group, and the NCI, that aims to advance the development of targeted treatments for children with leukemia. The Children's Oncology Group has initiated a multi-center clinical trial to evaluate targeted therapy for children with neurofibromatosis type 1 associated low-grade gliomas. And the FDA has approved an immunotherapy drug called dinutuximab as an upfront therapy for high-risk patients with a neuroblastoma. Also, complete macroscopic excision of the primary tumor after induction chemotherapy has appeared to improve survival outcomes among children with stage 4 high-risk neuroblastomas. And those are just some of the new things that we're seeing. And then some other possible treatments that are being looked at are: one, childhood cancer researchers are discovering more about oncogenes and finding new ways to stop the development of cancer by targeting these bad genes to determine the best way to treat cancer within the child's body. Also, researchers are looking at using viruses to infect cancer cells and trick the immune system into killing those cancer cells. This is called oncolytic virotherapy. This cutting-edge research uses altered versions of viruses such as polio and herpes to fight leukemia, brain tumors, and other solid tumors. Right now, we're looking at a phase 1 trial coming out soon. So these are just some treatment updates you might be seeing as you go along. And these are all as we progress in the fight against pediatric cancer. And keep these in mind as we look to improve the survivorship of these children. Mary Kay?
Thanks, Karen. So I just want to begin with mentioning, for those of you that are familiar with the Staying Connected program, I think you'll find that not only is the program that we are going to share with you today more robust than it has been in the past, but it's been enriched immeasurably by the incorporation of stakeholder perspective. So as Karen alluded to earlier, we have videos included, and it's really embedded and woven through rich content. And so from a professional perspective, we have physician input, oncology nurse, social work, and school liaisons. And then most importantly, we have patients, parents, and siblings. For those who are new to Staying Connected, I think you'll find that there is nothing more comprehensive from a professional development perspective than this program as it relates to the educational and psychosocial needs of patients with an oncologic diagnosis. Additionally, much of the content is transferable to supporting the educational and psychosocial needs of patients with nearly any chronic or serious diagnosis. The setup of the program is broken up into 5 modules. Individuals can participate at their own pace, so there is no race to get this done once started. And people can choose to complete all 5 modules, or you can pick and choose. Well, we recommend people consider participating in all 5, and also in the order on your screen. It is absolutely not required. This decision should be based on what the participant is attempting to achieve. So for example, is the program being used as professional development and to train professionals, or is it being used as a mechanism of support? We will explore these options in the coming slides. Of note, the program is offered at no cost to the participant. CEUs are provided, and you will see that there is a pre and post test for each module. This is important for not only awarding CEUs, but I will also share that we really value the input here as we're constantly taking feedback from our participants to improve future iterations. Next slide. So a great way, as I mentioned, to use this program is to train staff. So this can be for a nurse or a school liaison or a social worker who is new, for example, to pediatric cancer. And in this situation, participating in all 5 will give the individual a well-rounded perspective that will serve them well regardless of their specialty. Another example is to consider using this to train school staff that have a student with an oncologic diagnosis. And then in that situation for school staff, you may prioritize specific modules. Next slide. So first, we'll take a closer look at leveraging Staying Connected to train school personnel. Broadly speaking, these are the audience types who will derive the most benefit, but this is certainly not to suggest that others may not benefit. As we all know, every school is unique, and you may determine that people in additional roles may find value in the program. Throughout today's presentation, we're going to give you a sneak peek from some of the video vignettes. And our first video is going to feature Lori, a longtime pediatric oncology nurse, and she's going to share some advice for schools.
I think it's important to remember, as an educator, as a guidance counselor, that even if you have another child diagnosed with cancer in your school and you've now encountered 2 children or 2 adolescents, their journey through their treatment was very different. It can be affected by the age of diagnosis, their actual diagnosis, the amount of medications they got, what medications did they receive, if they received radiation. When we're talking about a brain tumor survivor, did they receive radiation at a young age? Did we disrupt the growth of their brain, and are they able to function at the level that your leukemia survivor might? It's very different. We may see children with hearing loss. We may see children with vision loss due to their cancers. Their needs and their accommodations are going to be very different from somebody with maybe a solid tumor. Do they need just that extra time because they've got some cognitive issues due to intrathecal chemotherapy? So each patient, just as they go through treatment, we can give a laundry list of side effects for the medications they're receiving. And patient A is going to be very different than patient B. There's no predicting it. And when we're talking about off-therapy patients as well, their late effects that they experience can be very, very different. The majority of them don't have a lot of issues, but there are children who 5-10 years down the road may develop a significant late effect, which suddenly is impacting their ability to get through the school day, to take their testing appropriately. So it is really trying to figure out what each child needs. There's never a perfect plan. The protocol may have to deviate when they're on therapy as well, simply because their body reacts differently. On therapy and after therapy is going to be the same.
So in addition to thinking about specific professional roles that may benefit, we also wanted to highlight people experiencing certain situations and how they may find value in the program. So the first bullet here is most obvious in terms of who will derive benefit. And then also, it may be helpful when audiences have a sibling of a student with an oncologic diagnosis. So this is when, a brother or a sister has cancer, and this is maybe a teacher who has responsibility for teaching the sibling of that patient. There's a whole host of things that sibling is going to experience, and having the sibling's school staff familiar with what is going on and how to support that sibling is going to be really very helpful. Also, as people are designing specific support for children with whether it's cancer or other types of serious illnesses. And then we also really do think that undergraduate and graduate students who are preparing to be teachers themselves may find value in this training program. So our next video is featuring Haley, and she is a survivor of Hodgkin lymphoma, and she's going to share her perspective of how a school nurse can be most helpful.
I thought I had anemia. I was still going to school as much as possible, and the school nurse didn't know that, so she actually came up to me during one of my classes and was like, hey, like, are you doing okay? Like, do you need a break? Like, I know we have stairs. We didn't have elevators. So, like, walking up the 2 flights of stairs, I was like, wanted to, like, take a nap. So, she always said, my office is always open. If you need to rest, like, come in. Just come in whenever. Tell your teacher, like, hey, I need to take a rest in the nurse's office. So I think communicating is, like, the most important thing. Like, don't hide things from people like that. In the school nurse's perspective, I guess, is just also communicating with them and letting them know, like, your office is open if you need to take a rest, having somewhere to rest. Like, my nurse had a bed with, like, a curtain and a blanket and pillow, like, for people, just like normal people, if they felt sick, to just, like, rest. So that was really awesome. It's hard because I wasn't in school, so a lot of the times I would just be resting at home. But I think communicating between, the school nurse and through counselors is the most important part, because if they don't know, they can't help you.
Knowing that not everyone will have time to participate in all the modules, we have prepared learning pathway suggestions for key roles. So here you can see that we recommend that everyone begin with the introduction module, and then to pursue additional modules to ensure well-rounded understanding. I mean, really the best way, as I mentioned earlier, is to do all 5. But if you're not able to do that, everybody should start with the intro. And then school nurses, our recommendation that you would prioritize, if you could only pick one, would be the treatment and side effects module. And then school counselors and people with similar roles, you may benefit most from the psychosocial module. And then teachers and people who are responsible for coming up with 504s and IEPs, as an example, you may prioritize the educational module. If you do have the opportunity to watch all the modules, we do recommend watching them in that order, but you will recognize as you watch various modules that they certainly do build upon one another, and they will, if you do them out of order, it won't really ruin anything. But this is what we would recommend if you can only participate in one. So our next video is Dr. Mark Rinaldi, and Dr. Rinaldi is going to discuss the criticality of school and the lives of pediatric patients.
I think it's vitally important that schools recognize the significant contribution they have to the illness process for children and teens with cancer. The school is their hub. It's their second home. And in many respects, it's a respite for them, particularly for those kids who may have more of a rocky primary home life. And it's very important for schools to recognize that, be it cancer, be it any chronic illness, and to find a way to embrace this child, to embrace this family as a community, in a way that's sensitive to the patient, but at the same token, or at the same time, directional, and that is kind of moving the patient forward rather than holding the patient static or bringing them backward because of some unnecessary or unsubstantiated myth about the particular illness that they have. It's vital for schools to be connected to these patients from A to Z, from the start to the end, and then beyond.
Okay, so moving into training for clinical personnel, those roles on the screen are the most likely professionals that will find value in the Staying Connected program. In particular, when they are new to their role, or for those individuals that have only had time to focus on their specific area, and then they want a more well-rounded understanding of their patient's experience. It can also be helpful to clinical staff. Maybe they're experienced floor nurses or experienced social workers who are transitioning from another area of specialty into oncology. This is Julia. Her son had ALL, and she's going to share something simple yet really impactful that helped her cope.
I think as a parent, the most helpful thing during that time was just when I realized I wasn't alone, that there were other parents on the floor. And once those parents reached out to me, knowing that other kids were going through the same thing, or that I could see that maybe another parent's kid was ending treatment and was actually doing okay. Those relationships that we formed just with other pediatric cancer families really made a difference emotionally.
So I'll just highlight, if you don't have a family mentorship program at your hospital, you might want to consider establishing one. They are just such a wonderful resource, not only to moms and dads and siblings, but also the patients. So the experiential relevancy here, we've already talked about the first bullet. The other thing I would highlight here is that you may consider using this program in lieu of faculty and services and attending school meetings in person. So for hospital systems that are fortunate enough to have the school liaison position or other roles that serve in that capacity, where they go to the school and do that faculty in service, where they teach all the people in the school how to support the individual child, or attending school meetings in person, sending this in advance so that the school can become familiar and watch this, it may set you up for success for then just a much briefer follow-up phone call or Zoom meeting where you can get right into the specifics, the unique needs of that particular child. So hopefully it'll save your team some time in that regard. And I mentioned a little bit earlier, but I think the other thing for clinical personnel is you will find that this is also helpful for different teams that care for children with other chronic and serious illness. Certainly oncology is thread through all of it. I don't want to be misleading here. It's just that the recommendations that are coming not only from the professionals, but the patients, and the things that you'll see that we recommend are almost all transferable, regardless of what the child's illness is. Next slide. All right, now we're going to hear from Dr. Nilay Shah as he explains how he engages with patients and families.
patients and families have lots of different types of questions at diagnosis, and frankly, every single question that they have is a good one. It means that they're engaged. It means that they're trying to process what's going on. For kids, it's really quite astonishing how understanding they are of what's going on. The younger kids, they don't know to be afraid of this thing called cancer. They just know they're sick, and oftentimes when they're sick, they equate it to things like getting an ear infection or needing to have a tooth pulled. And so they say, okay, well, what do we have to do to get to that next step? And as long as we answer their questions honestly, but in a compassionate way, we can get them through that. And so oftentimes the biggest challenge is getting them to be not afraid of what's going on. Families have all sorts of questions. Some people are just shell-shocked and are just trying to figure out how do we get to the next day. And some families are already zooming ahead to, okay, well, what's treatment going to look like, and what's going to be the next step. The biggest questions obviously up front are going to be, okay, what are the odds for my patient, for my child?
And here are our learning pathway suggestions for clinical personnel. Again, beginning with the introduction module. And then for the more clinical people, so your residents, nurse practitioners, and nurses, obviously the priority module for those groups would be the treatment and side effects module. For social workers and physicians, we think it would be helpful to prioritize the psychosocial module. And then for school liaisons, hospital teachers, or for anyone who has that role where they are communicating back and forth and helping to design supports in the school setting, would be the educational module. This is Grant. Grant battled medulloblastoma, and he has some very poignant advice that everyone can benefit from learning. It's in the vein of not judging a book by its cover.
What level of classes am I taking now? Well, I've been on this, college prep course now. I've taken like anywhere from Bio 1 to Bio 2, general science to cooking classes. I took, mythology to really astronomy. Took some basic math to really algebra, and I'm going to take financial algebra. What else can I think of? I've took a just regular gym class to CPR class. Yeah, I'm in national honors for almost 2 years now. And I'm just surprised that I'm doing all of that.
So Grant is a great example of how when we are putting together plans for patients with oncology, it's so important that they are unique. Based on his slower speech and slower processing, it would be very easy to assume that Grant really required a lot of special education supports, when in fact, as you can tell, he was able to participate in very high level classes. And not only was he able to get that done, but he didn't even require the work to be modified. All right, so we're now moving into training using the Staying Connected program for training of community professionals. So here are the audience types that could benefit. I actually think this was kind of a hard list to come up with because there are so many different community organizations, and just depending on who they are and what they represent, there could be all sorts of people who would find benefit. Next slide. All right, this is Angel. Her daughter had ALL, and she shares an interesting story about how the patients sometimes modify their behavior based on the adults around them.
Funny because kids have a different personality at school than they do at home. And so I was so nervous when she went back to school, when she started kindergarten with no hair. And I bought her this little Hello Kitty scarf. And we got her ears pierced, and she had these little Hello Kitty earrings that she wore to school. And I'd always say, did anybody touch your scarf? Did anybody mess with your scarf? And she's like, no, Mom, no one touched my scarf. And then her teacher called me one day, and I was like, hey, how's it going with the scarf? Did anyone touch your scarf? And she was like, oh, so this is funny. And I said, well, what's funny? And she said, when you pull off, sometimes she takes the scarf off. And when you come back to pick her up, she puts it on before you come and pick her up. So I kind of think she's doing the scarf sometimes for you and not for her. And I was just very emotional about that. Yeah.
So this type of relevancy, just as we had a hard time coming up with the list, it can really be very broad. So I think the most obvious one is individuals who are new to a community agency or organization that supports patients and their family members with oncology diagnoses. But then also the individuals who are responsible for developing new programs, or maybe it's outreach materials, marketing materials, a list of resources, they would probably benefit from participating and staying connected. And then something that's not quite as obvious might be the individuals that are responsible for campaign fundraising. So the reason we think this is helpful is if they're responsible for bringing money into an organization that supports oncology patients in some way, they will really get a very good understanding of the journey and all the different aspects. And they may actually want to grab some of the videos, to share to a potential donor and kind of embed in their campaign. All right, next slide. So we find that many survivors define survivorship differently. Christian is a survivor of testicular cancer, and he shares his perspective of survivorship.
I've been a survivor my whole life. Like, not to get too off topic or too out of touch with things, but to survive and to live are different things. So every day I survive by moving forward, like by going towards the next day, but like cancer helped me live. Beating cancer and having it be like gone right now instead of, as opposed to like in remission or something, I appreciate life so much more than before. Like I take stuff seriously now that I didn't before. I care, like I can empathize and sympathize with people. I learned that you can buy a million things in the world, that you can buy as many things as money can buy, but you can't buy empathy. You can't buy perspective. Like you have to live that in order to experience it. And that's what being a survivor is. Being a survivor is loving and caring about yourself and being able to channel that into loving and caring about someone else. Because you can never know truly how someone feels. Unless you live their entire life through their eyes, you can't know 100% how someone feels, but that's what being a survivor is. It's knowing how someone feels.
So the learning pathway suggestions, they're going to be dictated obviously by what your purpose is. But a lot of the community organizations that support oncology patients do have therapists. So in that case, we would recommend that the priority module be the psychosocial module. And that as I mentioned earlier, something else that I would highlight is that those responsible for the fundraising campaign, for a holistic perspective, really may benefit from the entire experience. All right, next slide. So moving into the grief module. So here we have the audiences who can benefit most from participating in the grief module. So most school districts have a team that is responsible for crisis support. So anyone who is on that team that has never actually supported the school, meaning the staff and the students post a student dying, may benefit from watching this, or even those that have, if they have never had a student die from cancer, I think that they would benefit from this. Also, if you're not a part of a team, but you are a school professional and you have a student who is dying, the peers and the sibling of a student who is dying or has died. And then members of the clinical team. So if they are the nurses, the social workers, et cetera, and you are helping to take care of patients who are at risk for death, I think they would also benefit from the grief module. Of course, community professionals who offer group and individual therapy, and then individuals that may be responsible for putting together some curriculum or some resources for grief. And of course, therapists and counselors would also benefit from participating in the grief module. All right. Okay, this is again Dr. Nilay Shah, and he's going to share how grief varies from family to family.
When a child is diagnosed with a cancer, there's obviously going to be some grief. There's going to be grief about what impact that's going to have on the child in the short term. And that grief is very different for every patient and every family. And also it's very different where you are in that. It's also very different for where you are in that journey. Families definitely should feel okay being sad and having grief up front. It's better to acknowledge that sadness and to learn how to get through it so you can help the child. But when you deny it, it just becomes an anchor that's on you. Unfortunately, as I mentioned before, we still have a lot of our patients who aren't survivors, and the cancer does eventually take them. And the journey through that grief is a whole separate thing. It's a very individualized thing.
All right. Can you still hear me okay? Looks like my internet's slightly slow at the moment. You can hear me?
I can hear you.
Okay. All right. So for experiential relevancy here, you know, obviously those individuals will derive the most benefit if they are new to providing grief support. But those experienced professionals who have done this for a long time, you may find value in borrowing some of the videos or the contents to supplement your existing work. And then of course, curriculum developers will find value in the content and also the videos as you develop your own training programs. All right, next slide. Okay, this is Teresa. Teresa's daughter, Lauren, unfortunately died from AML, and she provides some advice about how to interact with parents who have lost a child.
I think the main advice that I know I appreciate is that I don't want them to not talk about her. I think it's really important that I want them to, you know, say her name, and I want them to bring up memories, because she, to me, she's, you know, she's still here. It's just she's not physically here with us on, but she's here. And I think that there may be times when people apologize if they bring it up, and you know, I always tell them, oh no, you know, it's okay. I don't want people to forget about her. And even when people ask me now, they may not know our story, and they'll say, well, how many kids do you have? I still say I have two daughters. And so I think it might be, you know, maybe it is awkward for some people not to know what to say, but I just don't want them to ever, I don't want her to ever be forgotten. So I don't want people to not talk about her. I would rather them talk about her, and if it makes me sad, or it's not or makes me cry, it's not necessarily a sad cry sometimes, because when we talk about her, we can remember the funny things and the good things, and, you know, laugh. I mean, she was always one to make you laugh. So, you know, that makes me feel good. So I guess I would just say that it's okay just to feel how you feel. I mean, hopefully, wouldn't want people to be afraid not to talk about her.
Okay, so the learning pathway suggestions for grief support is obviously, as we recommend with the others, to begin with that intro module. And then the priority module is of course, the grief module. A secondary priority though would be the psychosocial concerns. And then to address the questions children and adolescents may have about the cancer, it may also be helpful for people who are going to be a part of the grief team to also watch that treatment and side effects module. So for example, if you are a part of a team or you're going to be doing some group therapy and really focusing on, the patient or the patient's dying, it is not uncommon, at least for children and adolescents, to start pivoting the conversation to asking about cancer itself. And so having the person who is the facilitator understand how to answer some of those questions about how people get cancer, the different types of treatment, when they're pediatric, that it's very unlikely, that pediatric cancer patients do in fact die. Having that background is going to be really important, because a lot of children and adolescents will pivot the conversation this way. So that in that regard, we recommend that somebody on the team be familiar, and that treatment and side effect module will be helpful in that regard. Next slide. Okay, so now so those are sort of all the things that we recommend from how you can use this program from a training perspective. And this is then pivoting into support. And so we really believe that people in all these categories, so parents, patients, siblings, and family and friends, will find that this program is beneficial from a support standpoint. Okay, so here we have Angel again, and in this clip, she's going to discuss the impact on her other children, so the siblings.
The impact on the other kids, I think all of them have been affected slightly differently. Angelina's big sister would also take shifts at the hospital, and so she is just so close to her and is like another mom to her, and is just will do anything for her. And I think her older brothers have all dealt with it differently. Her older brother, Elon, who's 16 now, we didn't really understand how much it was affecting him until the guidance counselor told us that he's been coming and talking to them about Angelina and hoping that she's okay, and just the stress that he had that he wasn't even telling us about. We didn't know that it was affecting him. And then her younger brother, Joshua, was right around 1 when she was diagnosed. And for him, it was difficult. And for me as a mother, it was difficult too, because I couldn't be there for my young son all the time. And it'd be nights that I'd be away. And so for him, I think he's a little more clingy now than he may have been if we weren't experiencing that. And he's also very overprotective about Angelina, and he worries about her.
Okay, so from a support standpoint, these are the audience types that we believe would benefit. So most obvious, parents that have a child with an oncologic diagnosis. And then in terms of the patients themselves, probably those that are in the upper elementary age through college would find value in participating in this program. And then of course, siblings and peers and family members. And then one last mention here is that those stakeholder groups that I just mentioned, if they are coping with another chronic or serious illness, they may also find value in portions of the program. We heard from Kristen's mother, Teresa, just a few moments ago. And so Kristen's sister, Lauren, died of AML, and she has an interesting perspective to share.
So important is just to have the schools be aware of the situation and don't hide anything from the students per se, because the students, things will get caught up and rumors can start so quickly, and you don't want that to happen. You want the students to know just as much as the teachers, not in so much detail, but just what's going on, as long as the family says it's okay. And I think that's what was helpful with being so close to the staff at our school. Through even this process, we just became even closer. We would tell her close friends things, but them being aware of the situation and what things were looking like was just being honest with everyone.
Okay, and so for the experiential relevancy part here, so stakeholders looking to better understand cancer more broadly and the psychosocial implications will derive the most benefits. And then the videos and the stories will probably provide just some helpful perspective, looking at things slightly differently. And you may find that people find benefit in just the recognition that I'm not alone. I'm not the only mom. I'm not the only patient. I'm not the only sibling. And they may really enjoy the creative ideas that people have to offer. And then, of course, patients may benefit from learning from peers about self-advocacy strategies as well. All right, next slide. So here are the learning pathway suggestions. So we recommend, again, that beginning with that intro module. And then the parents and AYA patients priority module would be treatment and side effects and the educational journey. If they have time, then looking at that as a secondary module, the psychosocial. And then siblings, peers, and extended family, we recommend the psychosocial module. The other thing I wanted to mention is, we spent a lot of time today highlighting the videos of all these stakeholders because we feel like it is really enrich the program. But do know that experts put together every aspect of this. So you're going to see resources like this throughout. So this is just an example of one chart. There are charts, and it's a very traditional professional development program in the sense that there's just rich content. And then what we've done is we have sprinkled in some of these stakeholder videos that just reinforces the point or gives a slightly different perspective. Karen?
Thank you, Mary Kay. So in addition to the Staying Connected program, there is a wealth of information located on the Leukemia Lymphoma Society website. Here specifically are some things related to pediatrics and for healthcare providers. The two palm cards there are where you can find a lot of the information that's available. And as you can see, even below, we've listed the Staying Connected program, which I'm going to go into a little bit more in a minute. And in addition to those resources, we have some personalized one-to-one support that's available not only to patients and their families, but also to healthcare providers. So our Information Resource Center, or as we all call the IRC, is comprised of 14 highly trained information specialists, social workers, nurses, cancer information special educators, that type of thing. They all have an expert knowledge in the hematologic malignancies, and actually 3 of them have expertise in pediatrics. They respond to inquiries from patients, parents, caregivers, healthcare professionals, whomever. They do this by phone, email, and answer chat, and they provide personalized information, support, and resources to the caller. Then we also have our Clinical Trial Support Center, the CTSC, and that's a unique and comprehensive department. It's staffed by 9 full-time trained nurses who support patients and their families in a very personalized and intensive way through the challenging process of finding and enrolling in clinical trials. And again, here we have pediatrics expertise with 2 pediatric nurse practitioners that are a part of that staff. And then you see our nutrition consultations. And here, patients and caregivers can receive free one-to-one phone and or email consultations with a registered dietitian who has expertise in oncology nutrition. This service is actually available for all cancers. And then you see we have financial information, support groups, online chats. We have our LLS community. The support groups are both regional as well as national. And then our disease and survivorship print and online information. And here are just some things to see. We have a new ALL booklet that is now focusing just on children and teens. In the past, it was an ALL booklet and there was a piece of it that had children and teens information, but now they have their own booklet. And then while we keep all of our coloring books available, we now have a new coloring app. Here we've taken some of the pictures and information related to cancer and added those in. And then also some other fun things for children to experience, just in terms of giving them something else to do either while they're in the hospital or just at any given time. So back to staying connected. This is the page on the website. You know, as we've discussed, communication is critical, and it's important in providing support to the student. So we've created this resource to educate, or in some cases re-educate, professionals and parents on cancer and the effects it has on these students. Much of the information and videos that we presented today, you're going to see in this online program. Mary Kay mentioned some of this before, but it is a 6.5-hour CE program, which includes the grief module. The program is free. The CE credit is available for nurses and social workers, and school personnel can get certificates of attendance. You'll see more comprehensive information on the diseases, the treatment, the education and psychosocial issues and strategies that are there for you, school and hospital personnel, parents, all to support the child, their siblings, their classmates, and your colleagues. And as Mary Kay said, you can take this over a 16-week period. And this is the website where you can find it. We are actually in the process of updating not only the information, but the platform. So if you've taken it before and go back in, you'll see some changes. But hopefully these changes are not only going to enhance the program, but also make it easier for you to access the various information. And we will be adding some additional things, such as a panel discussion on how to actually do classroom presentations as well as a mock presentation. And then here, this is just a clip from the registration page to just show you what that looks like, as well as the fact that there are resources if you have any problems or technical difficulties. And then lastly, since this is an on-demand presentation and we're not going to actually be there for any questions, if you have any other questions related to this presentation itself, you can reach out to either myself or Mary Kay. And then if you have any questions about staying connected specifically, if you go online and try and access the program, Caroline Kornhauser, who is a member of my LLS staff, is available for anything that you need. And we'd just like to thank you for your time today and for listening to what we have to say. And hopefully you enjoy it and enjoy the rest of the HEAL presentations that are available to you. Have a great day.
Thank you.